In this presentation, we will look at some basic principles on how to protect the patient from radiation. One of the first and easiest ways to protect our patient from radiation is through reducing patient dose by reducing field size. We call reducing field size collimation. The less of the body that is exposed to radiation, the lower the patient dose. Collimation limits the tissue being exposed to radiation from the primary beam. It is the interpreting radiologist or radiology group that determines the standards and protocols in the department for radiographic examination, and this includes collimation. Generally, collimation should be approximately 1/2 inch beyond the skin line or the area of interest. Another easy practice that helps reduce patient dose is shielding. There are many types of lead shielding available in order to protect the patient's body from radiation. Some common types are contact shields. These shields come in direct contact with the patient's body. An example of a contact shield is a lap shield or a half shield. These are the most common used shields in the radiology department. They can be laid across the patient's lap to protect the gonads from being exposed to radiation. They also usually come with a Velcro strap which may be used to wrap around the patient's waist when performing upright exams, such as a chest x-ray. Another shield is a gonad shield, which is small and is made to just cover the area of the gonads. These are not likely to be used since the lap shield covers a larger area, including the gonads. Lead sheets can also be used as contact shields. They can be used to cut into any shape. For example, in the top image on this slide, a lead sheet was used and cut to make a breast shield. Another type of shield is a shadow shield. These shields do not come in contact with the patient. These shields are attached to some type of arm. The rolling shield in the image above is an example of a shadow shield and is often used in the X-ray department when performing a chest X-ray. These shields do not touch the patient. Some shadow shields are made to attach to X-ray equipment so that they can be used when a sterile field is needed. Let's look at some general practices when shielding. Shielding should be utilized for every exam except for a few exceptions. First, if the shield would interfere with the quality of the exam. Shielding practices are often only utilized for the radiosensitive gonads in the imaging department. But there are other radiosensitive organs that would benefit from the protection of lead shielding. These radiosensitive organs include the thyroid, breast tissue, small intestines, and the long bones in children. It is especially helpful when the field of view is within 2 inches or 5 centimeters of the radiosensitive organs. Radiation protection standards require that the patient's gonads must be shielded any time that they lay within 2 inches or 5 centimeters of a properly collimated beam, provided the diagnosis is not compromised. However, it is the practice and policy of the Radiologic Technology program here at HAC to shield the gonads of all patients, regardless of exam, age, or sex, unless it would compromise the diagnostic quality of the image. Recently, it was stated through several different organizations that students should not shield for abdominopelvic exams. These would be exams such as the abdomen, pelvis, and hips. You will be learning more about this in your lab for your 102 class. Listed here are some common do's and don'ts of shielding. Do's. You want to shield everyone unless it would interfere with the quality of the exam. You want to make sure that you shield more than just the gonads if possible. You want to establish good habits, making sure that you have that lead shield available to use whenever possible. There are many places where you'll go that you may see an older patient is not being shielded due to their age. However, again, it is HAC's policy that we shield everyone, including the elderly. The don'ts. You want to make sure that you are not placing the shield in the field of view. You also don't just shield the gonads. Again, you want to shield as much as you can as long as it's not obstructing the anatomy of interest. Don't delay an exam for shielding in a critical situation. And lastly, don't cause alarm. What does this mean? If you're in a room and you notice a technologist not shielding a patient, do not call them out on it in front of the patient. This could alarm the patient as to something being wrong. There may be a reason why the technologist did not shield the patient. You may just not be aware of what that situation is. Know that it is the registered technologist at your facility who has the final say in whether something is done with an exam or not. Students should always defer to the radiologic technologist expertise. Questioning the technologist in front of a patient will only lead to the patient becoming alarmed. Next, we will take a look at pregnant patients in radiology. Students and the general population are always very concerned about X-ray exams performed on pregnant patients, and they should be. Radiation to the fetus can be dangerous. The radiology department should provide educational materials in the form of brochures, videotapes, and other information in the waiting areas that address these concerns. As a technologist, you should always ask childbearing age of females if they could be pregnant and the first day of their last menstrual period. Childbearing age, in general, is between the ages of 10 and 60. It can be very uncomfortable to ask a 10-year-old to ask about pregnancy and last menstrual period. We often start this conversation by asking, have you started having your period yet? If they have started their menstrual period, then you must ask about possible pregnancy and the first day of their last menstrual period. If there is any question about pregnancy, the technologist should notify the radiologist or supervising technologist. It is their responsibility to determine if the examination should be canceled or should be completed based on the information from the referring physician. For non-urgent procedures, it is possible to have a policy of elective scheduling, which means that the X-ray can be scheduled within 10 days of the onset of their last menstrual cycle in order to avoid the possibility of pregnancy. There are new standards that are coming out, and there are some facilities who do not shield pregnant patients, and we will talk about that towards the end of this presentation. The last topic I want to talk about in this video involves bystanders and family members. It is the job of the technologist to ensure the area is safe prior to taking exposures. This requires notification during mobile exams and all personnel and family in the area of the X-ray equipment. It also means not having family or other technologists in the room when performing exams if possible. When others must be in the room, for example with a pediatric patient, it is the technologist's responsibility to ensure they are properly shielded. It is policy of the program that students may not, repeat, may not be in the room to assist in holding patients or imaging devices during radiation exposures. For mobile and fluoroscopy examinations that require personnel and students to be in the room during radiation exposures, it is the technologist's responsibility to ensure that the principles of time, distance, and shielding are properly being used by everyone. As stated earlier, there have been recent changes to the shielding policies at several clinical sites. For this reason, students must make sure that they understand the shielding protocols at each site and follow the procedures set forth by each facility. At HAC, shielding is still being taught and should be performed on all exams, in the lab, and at the facilities that continue to promote shielding practices. Due to advances in technology and current evidence of radiation exposure risks, many organizations have reconsidered the effectiveness of gonad and fetal shielding practices. Evidence has shown that doing away with shielding practices lowers doses than similar exams performed decades ago, has no direct evidence linked to radiation doses in diagnostic radiology to measure harm to gonads or the fetus. Shielding may obscure anatomy, resulting in compromised diagnostic information and repeat exams, and shielding can negatively affect automatic exposure control, a feature commonly used in modern X-ray equipment. The following listed here are groups that have agreed to discontinue gonadal and fetal shielding. At any time, you can look information up on any of these groups, and they will have information on shielding practices and why they have changed those.